Following the second incident of Marburg virus disease detected in West Africa, the Nigeria Center for Disease Control and Prevention says several measures have been put in place to prevent an outbreak of the disease in the country. And the RISE correspondent, Benny Ark, tells us more.
According to World Health Organization, Marburg is a zoonotic disease transmitted to people from fruit bats and spreads amongst humans through direct contact with the bodily fluids of infected people, surfaces, and materials. The illness begins abruptly with high fever, severe headache, and malaise. Many patients develop severe hemorrhagic signs within 7 days. Case fatality rates have varied from 24 to 88% in past outbreaks, depending on virus strain and case management. The disease was first discovered in 1967 in Marburg and Frankfurt in Germany, and in Belgrade, Serbia. Since then, outbreaks and sporadic cases have been reported in some African countries. Although there are no vaccines or antiviral treatments approved to treat the virus, supportive care, rehydration with oral or intravenous fluids, and treatment of specific symptoms improve survival. The Nigeria Center for Disease Control says it is tracking the outbreak of Marburg virus disease in Ghana, confirmed by the World Health Organization. This is the second time the zoonotic disease has been detected in West Africa, following the previous incidents in Guinea in August 2021. The cases were reported in two unrelated males, 26 and 51 years old, who both died from the disease. The Nigeria Center for Disease Control says Nigeria has the capacity to test for the virus at the National Reference Laboratory in Abuja and the University of Lagos Teaching Hospital. Currently, no case of Marburg virus disease has been reported in Nigeria. However, the National Emerging Viral Hemorrhagic Fever Technical Working Group, coordinated at the NCDC, has been meeting to assess the overall risks of both importation of the disease and its potential impact on the Nigerian population to inform in-country preparedness activities. Benny Ark, Arise News.
Well, to discuss Nigeria's preparedness for a possible outbreak and the potential risks, we're joined by Dr. Ifedayo Adetifa, the Director General of the Nigeria Center for Disease Control.
Thank you so much for joining us, Doctor, tonight on the news.
Thank you for having me.
Let's begin by asking you, how concerned are you that this can spread very quickly into Nigeria, considering the proximity to Ghana and, of course, our travel between both countries?
Well, as the Benny said in the narrative, we have at the NCDC and working along with other partners conducted a risk assessment to inform sort of what level of alertness should we adopt and what are the commensurate preparedness measures that we need to put in place. And our assessment, the outcome of that assessment is that we are currently at moderate risk of having importation of Marburg disease and potential outbreak. Actually, the incidence of one case will be an outbreak because we've never had any before. And in response to that, we've of course then looked at various domains of preparedness that need to be taken into account. So of course the first thing is, can you make a diagnosis of Marburg? Okay, so we have always, regardless of what is happening elsewhere, retained the ability every year to be able to make diagnosis of Marburg by just stockpiling a small quantity of test kits. And what we have done in response to this is that we've actually expanded the quantity of test kits, which interestingly were additional kits were delivered today, so we can test should there be a sudden need to test an increased number of suspect cases. We can do that both in Gadua, and we will also share consumables with our colleagues in the Lagos University Teaching Hospital lab. So that's one. The Port Health authorities are alerted to look out for ill travelers. Of course, the key difference between, for example, COVID, which everybody's already tired of, and Marburg is respiratory pathogens, as long as you are breathing, and sometimes whether you have symptoms or not, you can transmit. For Marburg, just like Ebola, you do need to be sick to transmit, and you, as the report says, transmission is by coming in contact with bodily fluids of and materials that are contaminated by people who are sick and have symptoms. And so we are, of course, we immediately issued an advisory. We issued an A to Z about Marburg, just so that people know what this condition is about, because many people haven't previously heard about Marburg.
And as we speak, I'm sure many people still don't know. But I'm concerned that, I mean, with a 21-day incubation period, who's to say really that Marburg has not made its way into Nigeria? Can you, confidently say Marburg is not yet in Nigeria? If that's the case.
Well, your question touches on theoretical possibility, and of course, it's as long as there's a window, it is possible that has happened. But the thing to take into account is why we are giving out these messages, especially for our colleagues, healthcare workers and front lines, to have a higher level of suspicion. When you see cases that maybe at the lowest level of healthcare have not typically responded to the common causes of the symptoms you are treating, and you need to think about something else. Alert your disease surveillance and notification officer, the state epidemiologist, and all the authorities in the Ministry of Health, and ensure that we have a sample taken for onward transmission to the National Reference Lab for testing. Those
being done already? And in that report, Benny actually mentioned National Reference Hospital, and the first thing that came to my mind was, is it not already overburdened?
Well, we have a lot to do. We have to, quote unquote, maintain eternal vigilance, because we are in a continued battle with pathogens, whether the public is aware or not, which is why even when there is no obvious threat of Marburg, we have to retain, because the public does not want to hear that, oh, you couldn't diagnose Marburg. It's better you have kits and they expire than for you not to have capacity to respond to some of the threats that we face. So the National Reference Lab is not overburdened. We've not started or had a need to test for Marburg yet. Yes, there's a lot that we are doing, but that's the essence of the National Reference Lab. And also remember that we have a campus of the National Reference Lab in Lagos that we can always scale up things to, and other laboratories like Professor Milabu's lab in Lut and others that we can, if we need scale up is possible.
Okay. So you say we're at moderate risk. What level of alert is that? Is that amber? Is that red? Is that the highest level? Is that low?
That's more like amber. Because if we are red, we will set up an emergency operations center, as you know, for the disease, and and you would have the commensurate actions as well.
So what do we need to look out for?
Exactly.
As far as Marburg is concerned, what are the early signs that you see and say, okay, this might just be Marburg, or nothing to really be worried about?
Well, I'm sorry I don't have, it's the symptoms that you see that Benny already described for Marburg are the same you see if you have COVID, if you have malaria, if you have any. So there are no characteristic symptoms for Marburg. But yes, as it says, sudden onset fever, cough, malaise, muscle pain, joint aches and pain. And it is important, obviously, in this looking after investigative presumptive cases, to ask about history of travel or contact with recent travelers from the West African sub-region, because that will be sort of your most important clue as to whether this person has been in a setting or in a place, or potentially has been exposed during travel or otherwise.
And that brings me to my question. When you say we've not had a reason to start to test, if this has been confirmed and announced in Ghana, what those who have been to Ghana in recent times, those who continue to travel to Ghana, and those coming in from Ghana, we are not testing them? Don't you think we should start by that? Why have we not started testing?
Well, you do know that it's almost like saying that if you fly across the airspace for the particular country, you're going to get anything that they have in place. So
it's not better to err on the side of caution.
Of caution.
No, yeah, so you have to. Your caution has to be driven by evidence. So Marburg has not happened all over Ghana. Marburg has happened in Ashanti and near Kumasi, sort of regions of the country. So not even in the greater Accra area, or where you're more likely to find people going to the airports and all of that. There have been 2 cases. 2 cases identified as presumptive cases in early July, who were just confirmed, almost 2, then it was 3 weeks after, and who have passed on. The contacts of those cases have been line listed, they are being followed up. There's not been a secondary case from any of the 2 cases who have died. Right. Okay? So Ghana has not even had additional cases arising from the 2, despite them putting everybody, including healthcare workers who have been in contact with these guys, into quarantine. So you have to look at all of these risks, assess your risk, and not decide that we now need to screen all the
so you say out of 100 exposures in the case of Ghana and 2 fatalities, it's really nothing yet to worry about?
It's not. We do not need to screen travelers. It's not recommended. Neither we do not recommend it based on our risk assessment. Neither is it recommended by the WHO and other regional authorities. As you know, we do these things in partnership with relevant health security partners, and you know.
And I was just going to ask you about the fatality ratio for Marburg. Do we have an idea?
Well, it's not good. It's some estimates currently put that at 25 to 88% of cases. So you have to remember the Marburg is like the only other member of the same family as Ebola. These are sadly really nasty pathogens that have relatively high case fatality when they occur. Of course, we've got quite a bit of experience with Ebola now and know how to do better at providing supportive response and providing supportive treatment.
Dr. Ifedayo Adetifa, thank you so much for being on the news tonight with us.
Thank you very much.
The boss for the Nigeria Center for Disease Control and Prevention.